everybody, it's Dr. Dunn. I'm a surgeon who specializes in esophagus and stomach surgery in the San Francisco Bay Area. And today we're going to talk about two really important tests that we use to diagnose acid reflux or GERD. So these tests will let us know for sure whether or not you have acid reflux. And it's really important to us to be able to diagnose that with accuracy, because if we don't have that diagnosis and then we do surgery, then your symptoms may not get any better. So we really want to make sure that we understand what's going on before we do surgery. So first, let's talk about EGD with Bravo testing. So EGD stands for esophagogastroduodenoscopy. And translating that into plain English, we're looking at your esophagus, the food pipe that goes from your mouth down to your stomach. Then we're looking at the stomach, and then we're looking at the first part of your small intestine. So we abbreviate that as EGD. During the EGD test, we attach a small clip to the lower part of your esophagus called the Bravo capsule. And that little clip will record the acid levels coming from your stomach up into the lower part of your esophagus for 2 days. And then after 4 to 10 days, the clip falls off and you pass it normally through your digestive tract, and you go number 2 and you never know that you even had it. So the test will help us to tell whether or not you have acid levels coming up that are abnormally high, and whether the symptoms that you have, such as a chronic cough or regurgitation, meaning stuff coming up into your throat, or whether you have trouble swallowing called dysphagia, or whether you have heartburn, burning below your breastbone. The tests will help us to understand whether these symptoms are caused by GERD. So what are some possible side effects of doing the test? Really very minimal. Some people have a sore throat after they get the test because we have to go down with the scope and look inside their stomach. And some people feel a little bit of discomfort, but it's very rare. Out of hundreds of these tests, 1 or 2 people will have mild discomfort, which is managed with over-the-counter Tylenol. On the day of your test, the anesthesiologist will give you medications to make you sleepy. And while you're sleepy or asleep, we will pass a long, thin tube with a camera on it into your esophagus and your stomach. And then on the way out, when we're done with the test, looking at everything on the inside, taking any biopsies of any suspicious looking things, we will attach the Bravo clip. And that is going to transmit or give data about the acid levels in your esophagus to a box which sits around your neck. It looks like a 1980s pager. It's very stylish. And all that data is going to be recorded for 2 days. After 2 days, the box is going to turn off, and then you will return the box back to the original endoscopy suite where you got your testing done, the original hospital. And then they'll give me a call. They'll take the data off the box, and I'll look at it and interpret it and give you a call, let you know what the test results were. Some of the common questions that come up, patients ask, how long does the test take? Actually doing the tests and putting the Bravo clip in place takes about 10 to 15 minutes. Patients also ask, does it hurt? And no, it doesn't hurt. You'll be asleep and you won't feel any pain. Patients will ask, can I shower normally? And the answer is yes, we definitely want you to shower and stay clean. The box can stay within a few feet of you and it will still take the Bravo data. So that's fine. You can shower normally, but please leave the box outside of the shower. If the box is too far away while you're sleeping or showering or doing anything, it will start beeping so that you know that it needs to be a little bit closer to you. But it does need to be kept dry. Another question that comes up is, what can I eat after the test? You can eat anything you like, and we encourage a regular diet during that time. Please remember to stay off your acid-reducing medications while the test is running so that we don't get false negative data. So in other words, if you take the acid-reducing medication while we're measuring your acid levels, then it's going to change the test results and it won't work for us. If you're getting the testing done with me, then I'll send you an email with more specific details about where to go before the procedure and what medications to stop, etc. Now let's talk about something called mucosal impedance testing. This is a relatively new test that we use to diagnose acid reflux. It can be used to either supplement the Bravo testing or as a replacement for Bravo testing. The advantage of it is that it gives you results immediately, so you don't need to go home with a box for 2 days. I like this because it gets patient results faster with less hassle for them. What it's actually doing is it's measuring the gaps between cells. So when the cells of your esophagus are damaged with acid over a long period of time, they can basically have larger gaps between them, and you can have leaking between the cells. And you can measure the flow of electricity across the cells, and that resistance to flow is a term that we use called impedance. And so if you have lower resistance than usual, it's highly suggestive of GERD or another medical condition called eosinophilic esophagitis, which is closely related to GERD. This test has been around for a while, but newer developments have come out which have increased the accuracy of the test, and now it can be used in place of Bravo testing in certain circumstances. So what are the side effects of doing the test? There are no additional risks really of doing this test compared to the normal EGD. It's very safe. So how do we do the test? We do the EGD like normal, and then we place a thin tube called a catheter, which measures the impedance at the lower level of your esophagus. And that data goes to a computer, and the computer reads out the impedance and gives me an accuracy level as to how confident we are that you have either GERD or eosinophilic esophagitis. Some questions that patients commonly ask is, how long does it take? And it really only adds about 1 minute to the procedure. Another question that commonly comes up is the test accurate? When the test is positive, it's positive with high accuracy, meaning that you do have acid reflux. If the test is negative, there's a chance that you might still have acid reflux. Sometimes it misses people. And so in those situations, I would place the Bravo at the end of the study. And then when you wake up, we would talk about, now you have to wait 2 days and you have to bring the box home with you. What are the benefits of the test? Well, it can detect acid reflux and non-acidic reflux, and it can also detect eosinophilic esophagitis, as I mentioned. A lot of patients are interested in this test because it can help speed things along and they don't have to carry the box with them home. I can offer it at a few hospital locations, but not every hospital has this specialized equipment. So it's a case-by-case basis depending on how close to where you live. I hope this helped to answer some of the questions about acid reflux, Bravo testing, EGD, and mucosal impedance. Thanks very much for watching. If you have any more questions, please leave a comment below, or you can visit my website at www.norcalsurg for more educational content and videos. And please like and subscribe to my channel. I really believe that it's important for you guys to be in the driver's seat when it comes to decision making about your health, and a big part of that is getting well informed, getting the education so that you can ask good questions. It's our responsibility as doctors to make sure that you really understand what's going on with your health, and it's a big priority for me personally. So hopefully I'll see you guys in the next video, and please reach out if there's anything I can do to help. Thanks, have a good day.